The first nutrition management for SLE patients is to give them a low saturated fat and low cholesterol diet. Patients with SLE frequently have dyslipidemia characterized by elevated triglyceride levels and low high-density lipoprotein and are at increased risk for cardiovascular events. Patients with SLE should limit their consumption of saturated fats as they are already prone to have elevated cholesterol, increased risk for developing dyslipidemia and contributes to inflammation. There are many causes for bone loss in lupus including uncontrolled inflammation, poor absorption of calcium, vitamin D decrease due to lack of sun exposure, which can prevent calcium absorption in the supplementation of calcium more than 1,500 mg and vitamin D 20 microgram is indicated in cases of difficulty in obtaining those nutrients from the diet. Sunlight exposure is known to stimulate vitamin D production, but this elicits a controversy since SLE patients have photosensitivity. Since patients with SLE are at risk for glucocorticoid-induced osteoporosis and fractures, supplementation with calcium and vitamin D should be considered. Vitamin D supplementation with 2000 IU per day in patients with SLE is recommended. Vitamin C, an important antioxidant, prevents oxidative stress, reduces inflammation, and lowers antibodies levels, also preventing cardiovascular complications. Therefore, vitamin C should be supplemented in SLE patients' diet at a maximum dose of 1 gram per day. Sodium intake not only has no beneficial effect but also exacerbates renal dysfunction in SLE patients. For these patients, sodium intake should be less than 3 grams per day. Moderate protein intake of 0.6 grams per kilogram per day is useful for improving renal function in SLE patients. The restriction of calories in the diet alters the progression of autoimmune diseases. The National Academy of Sciences recommends the intake of 1,800 to 2,000 calories per day for a sedentary eutrophic adult, and of 2,200 to 2,500 calories per day in the presence of minimum physical activity. Stay active. Exercise helps keep joints flexible and may prevent heart disease and strokes. This does not mean overdoing it. Switch off doing light to moderate exercise with times of rest. Avoid excess sun exposure. Sunlight can cause a lupus rash to flare and may even trigger a serious flare of the disease itself. When outdoors on a sunny day, wear protective clothing and use lots of sunscreen.